Hi, I'm Natasha Tracy for Breaking Bipolar here at HealthyPlace.com. Today I want to talk a little bit about a very normal question that people ask, which is, when am I going to feel better from this mental illness, no matter what your mental illness is? People ask this when they enter treatment. People ask this when they relapse. People ask this when they change treatment. It's just a normal question that we all want to know the answer to, and that doctors want to be able to give you the answer to. Unfortunately, there really is no answer to that question. There is no defined period of time in which we know that you're going to feel better. So instead of focusing on the timeline, even though I think that's completely reasonable and understandable, it's better to focus on what you can do to facilitate wellness as quickly as possible. So to facilitate wellness, what you really want to do is focus on your treatment. So according to studies, the best thing you can do is have both a therapeutic element via psychotherapy and a therapeutic element via the medical model. So you should be doing those two therapies at the same time in order to facilitate the best wellness and the best wellness as soon as possible. And once you do go into psychotherapy, you find someone who you can talk to, someone you can trust, someone hopefully who specializes in your particular mental illness. They're going to teach you coping skills to deal with the symptoms of your mental illness. So it's really critical that you learn those coping skills, you take them seriously, and then you put them into action. And of course, regarding your treatment with a, say, psychiatrist, it's also really important that you take that treatment really seriously. So when your doctor prescribes a medication for you, it's really important that you follow the treatment recommendations and do what is asked. And the thing you have to keep in mind is that it is a very long timeline for most people. So medications often take between 4 to 6 weeks to work. We know that. And so you have to give a medication at least that long before you can say, yes, it works, no, it doesn't work. Even though you might be feeling really impatient, which I think is really normal, even though you might feel that way, you still have to wait it out. You have to wait for those coping techniques to really be effective. You have to wait for that medication to really be effective. You have to wait for enough therapy appointments so that you can learn enough coping skills to really handle what's going on in your life. All of this takes time. So I can't tell you that it's going to take 1 month or 2 months or 6 months. I can't tell you the answer to that question, but what I can tell you is that by you working as hard as you can on your treatment plan, whatever that treatment plan is, that's how you're going to facilitate wellness, and that's how you're going to decrease the amount of time that you feel unwell. I'm Natasha Tracy, and this is Breaking Bipolar.